You know, for decades, whenever we talked about HIV, the story was almost always one of crisis. But that story is finally starting to change. We now have the scientific tools to really fight back. But the biggest barriers we face? They're no longer just medical. They're human. So in this explainer, we're going to break down the state of the global fight against HIV, from the science that's working to the political will that we so desperately need.
And honestly, the headline news is genuinely good. For the very first time since this whole epidemic began, the number of new HIV infections around the world is finally actually dropping. I mean, this is a massive milestone. It's really a testament to decades of research, activism, and incredible investment. But, and this is a really big but, that one single global number, it kind of hides a much more complicated reality. So while the overall trend is pointing in the right direction, the epidemic isn't just fading away for everyone, everywhere. And this brings us to the crucial question. With such good news, why is the fight still so far from over?
To really get why, we've got to look past that big global average. The reality on the ground is more like a patchwork of different epidemics, and the progress we're seeing is incredibly uneven.
And this right here, it really shows you the two different faces of the epidemic. On one hand, we have these huge success stories, right? Like in parts of Asia, where prevention programs for sex workers and people who inject drugs have just dramatically cut transmission. But then on the flip side, you have Southern Africa, which is still the global epicenter. And in other key groups, like younger men who have sex with men, infection rates are actually going up. So it becomes crystal clear, HIV isn't just one single epidemic, it's a whole bunch of them.
Okay, so what are we actually using to fight all these different epidemics? Well, today our prevention strategies are more numerous and more promising than they have ever been. I find it really helpful to think of all our strategies as this big, expanding toolkit, with different tools designed for different jobs. All right, first up in the toolkit, and probably the one you know best, is the physical barrier. It's exactly what it sounds like, a device that physically blocks the virus from spreading. Of course, we're talking about the male condom. And look, when it's used consistently, it is incredibly effective. It's made a huge impact in places like Thailand and Australia. But here's the thing. Even for a tool as simple as a condom, making it work in the real world is, well, it's complicated. You can break it down into what some researchers call the 5 A's. People need awareness of them, they have to be available and affordable, they also have to be culturally acceptable, and crucially, people have to adhere to using them all the time. If any one of those links in the chain breaks, the tool just doesn't work as well. Okay, next tool in the box, chemical barriers. These are antiretroviral drugs, the same kind of medicines used to treat HIV, but here they're used to prevent it. The big one you've probably heard of is PrEP, which is a daily pill that can dramatically reduce someone's risk of getting HIV. But, and this is a familiar theme, just like with condoms, how well it works in the real world comes down to one thing, adherence. You've got to take it consistently. And then, if we're looking down the road, we've got immunological barriers. This is really the holy grail of prevention, right? A vaccine. Scientists are definitely working on it, along with other advanced ideas to create long-lasting protection. But we've got to be realistic here. A vaccine probably isn't on the table until 2025 at the very earliest, and it could be later than that. So while we're waiting on that vaccine, one of the biggest game changers, and I mean a huge one, didn't even come from a brand new drug. It came from a new way of thinking, a new way of using the drugs we already have. It's this incredible concept called treatment as prevention, or TASP for short. And look, this isn't just some abstract theory. As one expert, Dr. Sten Vermund, puts it so well, the discovery that treatment itself is a powerful form of prevention has been the single biggest innovation we've seen in years. It's just a revolutionary idea. So how does this actually work? Well, it's a really simple but incredibly powerful chain of events. First, you need universal testing to find people living with HIV. Second, you connect them to healthcare. Third, they stick with their treatment. And when that happens, the amount of virus in their body, their viral load, drops so low it becomes undetectable. And that is the absolute game changer. Because what it means is, undetectable equals untransmittable. You'll hear people say U equals U. A person with an undetectable viral load stays healthy and cannot pass the virus to their partners. It's a huge deal. So think about it. We have the tools, right? We have condoms, we have PrEP, we have treatment as prevention. The science is, frankly, incredible. But the biggest hurdles we're facing now, they're not biomedical anymore. They're human. They're social, they're behavioral, and they're political.
And this quote, wow, it just gets right to the heart of the matter, because all the amazing medical tools in the world are totally useless if people are too scared to actually use them. If someone's afraid of losing their job or their home or their family because of stigma, they're not going to get tested, they're not going to go get care. For public health to work, people have to feel welcomed and safe, period.
And these are the real tough barriers we're up against today. It's about making sure donor countries keep up the political will to fund these life-saving programs. It's about building up local health systems so they don't run out of drugs. And it's about tackling that deep-rooted stigma and fear that stops people from getting the care they need in the first place. These are the challenges that science, all by itself, just can't solve.
Okay, so all of this brings us to the path forward. It's become super clear that no single tool, no matter how amazing it is going to end this epidemic by itself. The future of the HIV response absolutely depends on combination.
A truly successful approach has to weave all of these different pieces together. That means using our best biomedical tools, PrEP, TASP. It means giving people the behavioral support they need to use those tools the right way. It means we need sustained political will to keep the funding and support flowing. And all of it, every single piece, has to be built on a foundation of human rights, making sure that everyone, especially the most vulnerable people, can get these services without fear. It's the synergy, the way all these things work together, that actually creates real, lasting change.
So, at the end of the day, we're left with this one big thought. For the very first time in history, an AIDS-free generation. That's not just some nice-sounding slogan. It's actually, scientifically, a plausible reality. The tools and the knowledge, they're in our hands. The ultimate question isn't about science anymore. It's about us. We have the science to end the epidemic. The question is, do we have the will?